Hello, my name is Juhan Yoon, and I'm a solution engineer with Esri's Geo Experience Center. Today, we'd like to share with you an important analytical capability called community contact tracing that can help public health and other organizations fight the ongoing COVID-19 pandemic. During the initial coronavirus outbreak, the disease was spread through a human-to-human transmission model. The well-accepted health procedure to contain the spread during this phase is contact tracing. Health officials identify who contacted who, and then they work to quarantine those who may have been exposed. However, as the disease transmission quickly transitioned to a community transmission model and grew in scale to a global pandemic, it now requires a new modified approach of community contact tracing that enhances the traditional contact tracing approach with the ability to better understand how and where the disease is spreading through every community. In addition to individual contact tracing, it is now important to know where and when people have been out in the community, at work, at a grocery store, at a beach, and so on. Let's get a quick demonstration to better understand how all this works. Here we have a fictional dataset of COVID-19 contacts recorded in a typical contact tracing spreadsheet. This contact data may be collected in spreadsheets, databases, contact tracing applications, or simple surveys like Survey123 for ArcGIS. For example, these are our initial 3 confirmed cases. This worksheet covers the people that the initial 3 people contacted, and the next worksheet of people list who the previous group contacted, and so on and so forth. Using ArcGIS Pro, we can import this spreadsheet and geocode the home addresses of each contact to quickly visualize their locations on a map. Here are all the 200 people plotted on the map. The red dots indicate a confirmed positive case, and the number in the middle represents the degree of separation from the initial 3 cases. The gray dots are trace contacts that have not tested positive at this time. To quickly check if there are any spatial patterns, we can create a heat map with just the confirmed cases, and discover this hotspot in the community with 13 cases. By leveraging the SafeGraph Points of Interest map layer, we can see that this cluster is in and around a skilled nursing facility in downtown Redlands. Let's continue our analysis by next creating a link chart. Here we can see the visual representation of how the contacts are linked, from the very first 3 confirmed cases to all the other contacts. For example, Willard contacted Colleen, Colleen contacted Madeline, and Madeline contacted Sarah. And the red colors again show who has tested positive as we use the link chart to visually see and trace all the contacts. By selecting the nodes and the links, we can also visualize this on the map and see how they are spread out spatially as well. Now going back to the link chart, we can see a few concerning cases like Michelle here, where she's the only confirmed case with nobody in between the contacts with a confirmed positive case. Since there's no identified positive contact link, there's a likely chance that she might have gotten it from an indirect unknown source somewhere else in her community. Let's dig deeper by bringing in another set of points, which are the places in the community that these positive contacts have visited in the past 14 days. By extending contact tracing to community contact tracing, we would survey each contact as to where in the community they went, where they went shopping, where they visited a park, ate dinner, anywhere they've been. They may not know the individual human contacts at each location, but they would know where in the community they visited. During the contact tracing process, additional community locations can easily be added on survey maps. Here I've plotted the visited community locations with a blue pushpin symbol and filter the patient data to only show cases like Michelle. In our community, there are 5 cases that aren't linked directly to other known human contacts, and as you can see, they're all spread out spatially. By looking at the link chart, you can see some individuals visited unique places that nobody else appeared to have visited, like this donut place. However, we can also discover at the center of the diagram that a good portion of these confirmed cases visited a common store named Home Plus. While nobody identified a human contact at Home Plus, they all visited the same location, which may indicate a potential health problem in the community for further investigation. These analysis capabilities are not only visual, we can quickly run a centrality analysis, which measures the importance and connections of each node in the chart, to confirm that Home Plus is indeed a high-impact node that may link multiple cases. Using a geographic approach for community contact tracing also allows contact tracers to integrate other maps and resources of data to better understand what is happening across the community. For example, using the SafeGraph weekly movement pattern data, we can see that Home Plus is a store with high volume of visitors that may not have been following current social distancing guidelines. These are just a few examples of extending existing contact tracing solutions with community locations to create a more holistic community contact tracing approach. Another complementary workflow that some organizations are implementing is location tracking and proximity analysis to perform real-time and historical analysis of possible contact exposure for internal staff. Depending on the task, your organization might also need high accuracy, real-time tracking, and the ability to analyze data to make sure that every staff are in safe distance of each other during operations, or to analyze possible risk if they may have been in contact with someone who has tested positive for COVID-19. Here we have location tracking data from 6 users conducting security patrol around the Esri campus. The data points were collected using mobile devices and Tracker for ArcGIS, which is part of the Esri suite of field apps. Tracker is a simple app that allows for real-time location tracking of personnel and can provide analysts with historical movement data like this. To determine if any staff were in the same location together, you can run the new ArcGIS Pro proximity tracking geoprocessing tool to quickly find if any of these people were in the same place at the same time for a specific dwell period, and then it propagates downstream to other potential contacts through time and space. Let's assume user 4 in our case recently tested positive for COVID-19, and we'd like to know who this person made contact with for longer than 2 minutes and within 6 feet. Running the tool will analyze the data and return this new feature layer that shows who has been in contact with who and also the timestamp for each event, providing another approach to trace contacts. Within a minute or less, we are now able to identify people who might have been potentially exposed from thousands of breadcrumbs or much larger collections of big data. With community contact tracing, location tracking, and proximity analysis, we can get one step closer to making safer and resilient communities and organizations. Thanks for watching.